The strain of virus is circulating in the UK. I don't think it's that totally new. It's been around a little while, but it does seem to be more infectious and spreading more quickly. It's not causing more severe disease as far as we can see, but it does mean that there's a bit of a gap. If you get these new mRNA vaccines, I think you don't get much immunity for about 10 days or so. But even a single shot, the double shot vaccines, is giving protection. So it maybe increases the risk after vaccination, but it does increase the risk that people will catch it, not that they will get a more severe disease.
That have certain mutations are spreading more rapidly in places like the United Kingdom, as well as South Africa and maybe parts of Europe. But at this point, and we're going to need to do more studies, more research, and particularly laboratory experiments to understand if these viruses are spreading because people are spreading them, or they're spreading because they've actually picked up a mutation that gives them a selective advantage. Those type of experiments need to be done and are being done at this moment. And I suspect in many parts of the world, and particularly the more vulnerable parts, of the globe, lower middle income countries, it's going to take several years, unfortunately, to reach that. So in the meantime, and this becomes ever more urgent during this winter season, wherever you are in the world, that we need to still rely on kind of the ABCs of public health prevention, and that's using face masks, reducing gathering sizes to prevent super spreading, and when needed, to prevent social contact, whether it's through lockdown, severe lockdowns as UK is doing, which parts of the United States are doing, or restricted, more targeted, focused lockdowns, such as South Korea is doing, and many other countries effectively.
There are a lot of things we need to do, but it's undoubtedly the case. We'll see more of these, and it won't be 100 years, it'll be 10 years or less. And so we need to be much better prepared. We've learned a lot about vaccines and how to get them out fast. The other thing we could have done, and we didn't do, is we could have prepared class-specific antiviral drugs which would have worked against all the coronaviruses. We have them for influenza, we have them for HIV/AIDS. For flu, you've got to roll them out very quick. But in a pandemic, that's not such a problem. So there's a lot we can do and a lot we need to prepare to get ready for it. We need to look forensically at every aspect of this. The sociology of it, the science of it, the epidemiology of it, the economics of it. And we've got plenty of different experiments across the planet with countries handling it well or badly, and we should compare them and take home the lessons of how to deal with this. We know that we've had 5 of these coronaviruses, jump across from bats into us over the last 20 years. Now, prior to that, there were only 2 of those viruses circulating in the human population, 2 common cold viruses, which we'd known about since the 1960s. Now we've got 5 new ones. 4 of them are still circulating. The original SARS burnt out. The Middle Eastern respiratory one, which is very bad, it kills about 30% of people, is still circulating, but at a very low level. And we've got 2 new common cold ones, which have gone globally, and we've got COVID-19, SARS-CoV-2. So it's very obvious that something serious has changed in the matter of getting viruses around the planet. And the obvious thing that has changed, the most obvious thing, is mass international air travel and mass tourism, including from countries that maintain live animal and live bird markets, which are part of their culture, and that's for national governments to address. But they're undoubtedly a danger when it comes to viruses jumping from wild animals into us. And so we're going to think a lot about it.
Making sure that we don't leave anyone behind in the world's population to benefit from this vaccine. And that means getting the vaccine out, not only to people in the United States or the wealthier countries in the European Union or the rest of the world, but even all the countries, including the lower middle income countries. And that's really important because this virus is not going to go away. It's highly transmissible. We are going to continue living our lives with this virus. So the vaccine is going to be key in order to controlling that.